review of existing literature, particularly randomized controlled trials, or RCT. So how do these three legs support nursing practice? Let's look at an example from clinical practice. Suppose we are interested in preventing ventilator-associated pneumonia, or VAP. In our hospital, monitoring the incidence of ventilator-associated pneumonia shows that rates have gone up. This is QI. To address the issue, critical care staff conduct extensive review of the literature and national guidelines. That is, they use EBP, or evidence-based practice. After completing the review, the staff may have identified research gaps that might be addressed using nursing research. And finally, staff may develop an approach to implement best practice and evaluate the results of the intervention. This is QI again. When you are asked how the policy on prevention of ventilator-associated pneumonia was developed, you would say that all three legs of the stools are needed to answer the clinical question. QI is used to monitor practice and evaluate patient outcomes. Evidence-based practice is focused on systematically reviewing the evidence, and nursing research conducts scientific studies when the evidence is lacking. Now I would like to dig just a little bit deeper into the processes involved in quality improvement. The Institute of Healthcare Improvement has developed an open school for health professionals, which has 6 modules on quality improvement. The first lesson of Module 3 presents the Model for Improvement, which asks 3 questions. First, what are we trying to accomplish? This question includes defining the problem and efforts to understand complexity. Knowing that the goal is to reduce rates of ventilator-associated pneumonia helps to establish the scope of the problem to be addressed. The second question asks, how will we know that the change is an improvement? There are a number of tasks involved, which include identification of outcomes, establishing baseline measures, and developing sampling strategies. Finally,